Multiple sclerosis, or MS. MS results in nerve damage that disrupts the communication between the brain and the body. Multiple sclerosis damages more heavily myelinated areas of the brain, known as white matter. Background of patient 1. Helen is 28 years old and has started feeling weird symptoms. All of her symptoms match up with those of someone who has multiple sclerosis. One of her symptoms that heavily suggests that Helen has MS is the pins and needles sensation. This symptom is unique and is only found with people that have multiple sclerosis. Patient symptoms. Helen has started to feel symptoms such as a pins and needles sensation, feeling weak and tired, weakened vision, and unsteadiness walking.
Error in communication. Multiple sclerosis attacks the myelin sheath of projection neurons. Projection neurons send axons to distant brain targets. The demyelination of these neurons is what is causing the physical symptoms that Helen is feeling, such as the pins and needles sensation and unsteadiness in her walking. Over time, it is more and more difficult for messages to be relayed between neurons, and the nerve fibers become increasingly vulnerable to permanent damage. As a result of this, MS symptoms can become permanent. MS shown in images. These images show the effects that MS has on the white and gray matter of the brain. Symptoms supported by evidence. Helen described many symptoms that normally indicate a mild case of multiple sclerosis. She noted that she constantly felt a pins and needles sensation in her hands and feet. This unique sensation is what most doctors use to decide whether or not to diagnose someone with multiple sclerosis. This is mostly due to the fact that the sensation is almost entirely unique to MS patients and is rarely found in anyone else. Due to the fact that her diagnosis was made at such a young age, it's unlikely that Helen will display any new symptoms, but the ones that she already has will get worse with time. By the time she's 50, her balance, basic motor coordination, and her eyesight will likely be gone. But because of the early diagnosis, treatment is a lot easier to undergo.
Although there is no cure, there's a number of possible treatments to reduce the relapse time or flare-ups of the disease. Beta interferons are most commonly used on patients with MS, which reduce flare-ups and lower the white blood cell count in your body. Glatramine is another type of medication that stops the immune system from attacking the myelin sheath. A primary care physician is a huge factor in helping treat MS properly. Most people see a PCP regularly, so they will most likely catch the initial symptoms and recommend testing for a diagnosis. From there, they may send or recommend you to a specialist like a neurologist. Neurologists are doctors that specialize on the nervous system. To ease MS, they can help patients control symptoms in the body. They prescribe medication for patients as well as teach them to deal with living with MS. Neurologists provide detailed information surrounding a diagnosis that a PCP cannot.